Let's get started again. All right, guys, welcome today to our live chat. Thanks for being here. I have a very special guest here, which is a world-renowned urologist. He is an infertility specialist and a good friend of mine as well. His pedigree is ridiculous. He went to University of Pennsylvania Medical School. He did his residency at Northwestern University. Fellowship, I'll let Dr. Schoor talk about his fellowship, but he just has been trained by some of the world's leading urologists and also is considered a world expert in infertility, male infertility, and has a tremendous reputation here in New York. And honestly, he's been a role model for me as well as I've kind of kicked up my practice and started it off. And so I really looked up to him and gotten a lot of advice from him about how to approach and tackle my first years in practice. Now, my advice to medical students and pre-med students is that one of the things that helped me in my career is I always kind of latch on to people who have already done it. Like, why would you reinvent the wheel if you didn't have to, right? If you could ask someone, hey, what did you do and how did you fail and how did you succeed? And they give you the answers. Why would you experiment yourself? And so I'm going to try to do more of these and have some of my more experienced attendings on here to try to offer advice to all stages, residents, fellows, medical students, and pre-med students. And we're going to be doing Q&A sessions like this as well. So Dr. Schoor, thank you so much for being here. Can you just give us a quick introduction of why you went into medicine and why you chose urology?
Thanks, Dan. Thanks for having me. Well, that's you're putting me back on the spot, back to my medical school interview days. So I'll start with where I am now. For me, being in practice for almost 20 years, out of training, so that leaves me almost 30 years since medical school, or at least applying to medical school. It's been a really good fit. I feel like I'm doing my life's calling. I feel like I'm really living the life I'm supposed to live. And if there is something better out there, it's not better. It would not have been better for me. And if there are things that are better, there's not that many of them that are better out there. So, looking back, why did I want to become a doctor? I think I always sort of wanted to be my own boss, which that has certainly changed over the last 30 years of students coming out now. They don't have that sort of motivation, but for me, that was very much part of my motivation, to be my own boss, have my own practice. I definitely wanted to use science and technology and work in that field. I didn't want a traditional office type work. I never really had the interest in sort of the nitty gritty of business and finance and so on. Although I do quite a bit of that now.
Yeah, unfortunately, right? Unfortunately, we all do, I think, in the business of medicine. What do you do on a day-to-day right now? Just to give our students a little bit of insight, what does your typical day as a urologist look like, and what kind of pathologies and patient complaints are you treating, and how do you fix them?
So urology is a field that treats disorders of the urinary tract in men and women, things like kidney stones and urinary infections and blood in the urine and voiding dysfunction, kidney cancers, prostate, urothelial carcinomas. And it also does reproductive medicine and surgery of men, so as opposed to women, which would go to a gynecologist. If it's a reproductive issue of the man, whether that's sexual dysfunction or infertility, you would come to a urologist. And so I have additional fellowship level training, which occurs after residency, for male infertility and microsurgery and andrology, which is sort of male equivalent to gynecology, I suppose.
Hmm.
So my days over the past 15 years of really gearing my practice towards male infertility, I don't see that much of what, say, an other urologist might see, which is the general urology. I see more male reproductive urology, infertility, vasectomies, microsurgery, sperm retrievals, that sort of thing. So those are the kinds of problems that I see. Since this pandemic started, I do a lot of telemedicine, video consults, which I'm sure you do as well.
Yeah.
And, so that's been an interesting change. I find it an exciting change in medicine, and I hope it's here to stay. You know, I you know, I know we've been talking about missing the operating room, and I sort of have gotten back into that to an extent in my office. But I think that the change to telemedicine has been actually a very good one for our specialty.
Yeah, no, absolutely. I think that a lot of us who picked surgical specialties, we were enamored, or sometime in medical school, because that's the tough question, right? In medical school, I remember being very stressed the first couple years, wondering what specialty am I going to do. I felt like that was a huge life decision that was going to dictate my trajectory of happiness or unhappiness, or even the impact I was going to make on a day-to-day basis. And so for me, when I remember the day I saw like a joint replacement surgery, I saw like the synovial fluid just leak out of it just explode out of the knee, and you saw the arthritis that you saw in the x-rays. You could like see in front of your face, and you're taking this like big rongeur and you're removing the arthritis and just shaving down the bone. You're reconstructing this knee. And I was like, holy moly, that's a human knee in front of me. And then they're going to wake up and they're going to walk. And I would see them in the clinic and they would just be like, oh my goodness, you saved me and all my pain is gone. And I think that that's one of the big things, almost like instant gratification about surgery that we all get pulled to. So do you have that similar kind of experience in urology? Like, what is one procedure you do there that, you kind of, the patient wakes up and then maybe you see them back in the clinic and something changes drastically in their life for them?
Well, first of all, many things that we do in urology are exactly what you're describing. But I'll get back to something you said a little earlier, which is the stress of picking the specialty. I think it is probably the most important decision that a medical student can make. And when you make it, I think you really need to know yourself and be able to envision yourself in 20 years. So if you go perhaps into the nebulous, well, I'm going to go into pediatrics because I love kids.
Yeah.
Which is a common reason. Maybe that will be a good choice for you, maybe not. But I think the decision should be a little more introspective than that. What exactly do you love about kids? Do you love your kids? Do you love someone else's kids? Do you like the parents? Do you like the conditions? Do you like being in the office as opposed to the operating room? One thing, do you want to take phone calls all night? In urology, I do find it very gratifying to, say, take a person who is septic, and really
What is sepsis? What is septic?
So sepsis is a blood infection, and it's life threatening. You can die really within hours unless it's treated.
And you see that pretty often in the ER?
We get it more often than I want. Yeah, definitely. So almost every time I'm on call for the weekend, I will put up a stent in the ureter for a person with an infected stone. So what that is for med students is that
what's the ureter?
So the kidney's up here. The tube that goes from here down to the bladder is called the ureter, and you can be passing a stone, which is very painful, but not really life-threatening. But if the person has a fever and an infected urine when they're passing the stone, that's a life-threatening condition. And if I get called at 1 o'clock in the morning from the emergency room with a person who's passing a stone and has a fever, I'm getting out of bed immediately.
Yeah.
And I'm coming into the hospital, and I'm calling in the OR team, and we're placing a stent. And I, I don't like getting out of bed at night, but it's very gratifying because that person by the next day was fine, 100%.
That's
Totally
amazing.
fine.
That's
Incredible.
Amazing. They could have died if you didn't intervene.
100%. Absolutely. They would have died. Yeah, absolutely.
Like, if you think about that, if you were a med student and someone told you that you had the opportunity to save someone's life, you could intervene, do something, and bam, save their life. Otherwise, they'd be dead. I mean, we don't think about that as much now because we're in the thick of things, right? We almost get a little jaded. We're like, oh, big deal, no big deal. We just did it, But if you think about that from a perspective of what you want to do with the rest of your life, that sounds pretty incredible, don't you think?
Yeah, I mean, it's the stuff of movies, right? It's the stuff of TV shows.
Grey's Anatomy.
So I don't think I haven't seen really any movies of the accountant who moved the number from one box to another. Although there was a movie called The Accountant, but that was a different sort of. He was an accountant for the mafia or something like that. But it is true. It keeps me from getting jaded and burned out when I do get called in for these emergencies, to know that I'm actually delivering an incredible service that really very few people have the skill set to do. So in our town, which, let's say our catchment area, which is maybe 60, 70,000 people, there are only 5 of us, 5 people who can do that skill. That's pretty incredible if you think about it.
Yeah. About it, tens of thousands of people who are doing it.
Right. So it gives job security. So I've lived through, this is my 3rd major economic downturn since finishing training. 3. Okay. 2 of them were severe recessions, and this one is a depression. I don't care what they're calling it. This is we're in a depression right now.
Sure.
But my phone keeps ringing every day, and my problem is like yours. There's issues where the hospitals are not open yet, and maybe we can't get in to do the cases we need to do, but the demand is there.
Yeah.
And it's just getting pent up. So I think that we're not going to have difficulty putting food on our tables.
Yeah, we're lucky in that setting. We have lots. We're hearing about unemployment being at record highs already, 20-something%. I don't know really doctors who are worrying about getting fired. I mean, there's some reports of that, but for the most part,
it is happening. It is happening, and you got to sort of. I think this is interesting. I thought about this. Doctors who need to actually lay hands on patients and do procedures, I personally think are a little safer economically than physicians that can just do it remotely. Because if I can see now that telemedicine is sort of out there and it's not going away.
Yeah.
You can almost see companies hiring doctors just to sit there in like call centers almost, right? And sit there and just sort of deliver care online.
Yeah.
Whereas I don't think that's going to happen to urologists or spine surgeons or orthopedists or.
Sure. The interesting thing, I agree with you 100% on special, procedural based. I feel like the most protected, right, out of all the specialties. Like, there's other forces in medicine too. Like, if you're a primary care doctor, you also have like physician assistants, nurse practitioners,
right,
who are kind of increasing their scope of practice. Who they may provide good care, great care, but they're kind of moving into that space. Well, nurse practitioner or a primary care doctor, or a nurse practitioner or a PA is not going to be able to go and put a stent in and save someone from sepsis. That's not happening. So they're not going to save a patient from paralysis in spine surgery. And that's something that took an immense amount of training for you and me to learn. And at the same time, it's an incredibly difficult thing for us to do too. Like we took years and years to master it. But you know what it took in residency and fellowship to gain those skills, and just like kind of have our attendings teach us like the little maneuvers that you need to do to put the scope up the urethra. Let's go back to that real quick. So you remove that stone through the ureter, but you go through the urethra, which is basically the place where we urinate through, right? Like the scope goes through there. It's almost like the Foley catheter. So this is just to the medical students and residents who are watching, or pre-med students mainly. I think that's pretty intense. There's a scope, a camera that goes in through the area where, I have to urinate. And that's something I would be horrified at doing. I mean, is that something your patients kind of go, whoa, 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 don't touch me. Don't touch me.
Oh, absolutely. But most of the time we do that sort of thing. The patient's asleep. Although we do many procedures in the office under local anesthetic, and
like a vasectomy.
Well, vasectomy, sure.
I saw a vasectomy in medical school done in the office, and I literally I still remember like the tingle in my feet.
Right.
As
I do about 10 a week. I do about 10 a week in my office.
That's intense.
Yeah.
Do you want to just describe what that is exactly? Vasectomy in the office?
So the testicles are where sperm are produced, and sperm get transported through a muscular tube called a vas deferens, which men can feel on themselves. It feels like a nice thick piece of al dente linguine, very thick sort of tube, and we basically bring that tube right up to the skin level with our fingers, put some local anesthetic in the skin and around the vas, make a quick puncture opening in the skin, and cut the vas and burn the inner lumen of one of the sides, and then put everything back. It takes about 5 or 10 minutes per side, and that's that. And then now you take a person who was fertile before, and now they are 99.99999% likelihood to not be fertile. And it's sort of for I think the young people, it's they don't think maybe that's an important procedure, but for a family that's sort of living on the edge of economic uncertainty, one more kid can push them into poverty.
Yep.
In fact, in developing countries, one of the number one ways to get a country out of poverty is with birth control. Mm-hmm. So I'm involved in an organization that goes around the world doing vasectomies, so I think in the United States or developed nations, the average man has 2 kids, whatever, there's 3 kids. Some parts of the world, average man has 15, 20 kids.
Wow.
So yeah, so vasectomy as a major sort of procedure internationally in the fight against poverty.
Yeah.
Interesting. Another thing that we do in urology that has global implications is circumcisions.
Yeah. Yeah.
So circumcisions, you can decrease the risk of transmission of HIV with a circumcision by about 1,000-fold decrease in risk of transmission of HIV.
Wow.
So in sub-Saharan Africa, you can really almost eradicate HIV, not eradicate, but really drastically reduce with circumcisions. Now, there are certain issues, taboos, and so on and so forth with that, but that's one thing that we do in urology that's global. And
absolutely. I think that all these things you're mentioning, and again, kind of going back to what we want to talk to the med students here about, the pre-med students who are considering a career in medicine. is that, why I brought up the whole, describe what you're doing with the vasectomy is, yeah, my toes tingle when I hear about it. I'm like, oh, please, I never want to get one of those. But think about like the anatomy you're working with. You are working with like sensitive microstructures, like literally you're not just like messing around with, I don't know, bricks or I don't know, painting a wall. It's not like you're, doing something that these, you're handling human anatomy that has real consequences. Like if you snip the wrong tube,
Right.
or misidentify that anatomic structure, you're going to cause the patient some ridiculous harm. That's going to affect their entire life. And
Do you remember, Dan, the first time you saw the vena cava?
mm-hmm. I don't know if I'm trying to think. We all have different experiences. We all have different experiences, so I don't know if I've ever like looked at the vena cava. I've seen a beating heart before.
Yeah, right. Exactly. So remember the first time you actually see up in person a heart, a chamber of a heart, or the aorta.
Yeah.
It's almost like seeing. It's almost like seeing the Eiffel Tower for the first time. Like, wow, my God.
Yeah, absolutely.
That's the most dorky thing in the world. I don't know. But
no, I remember, honestly, actually, I saw the vena cava, but it was not in a live person. Even our first year anatomy classes, like everything about medical school, I remember just being like super excited about, right? Like you're like, wow, I'm in the anatomy lab. Whoa, there's like a cadaver in front of me. I'm going to dissect this cadaver in front of me. It's one of the like rites of passage of medical school and becoming a doctor is like these experiences that you will never get outside of medical school and medicine, and that's kind of an exciting part of the journey, I think, right? Medical school, all these little things you do, you when you interview your first patient, when you take your first history, when you do your first, I don't know, a sensitive exam, like when you do like a rectal exam or pelvic exam, all these things are like pretty intense, and they're like new things that you would never do outside of medicine, and that makes it special. And it's like that every part of the journey. And I'm not saying that it's always exciting, because there's always these days when you're just like, what did I choose? Why did I decide to, work 6 days a week and 12 hours a day? And I'm so tired. I just missed all my holidays with this past year. There's a lot of bitterness too that comes with that load you carry, but it's the privilege of experiencing something pretty exciting every single day, and it comes slowly. Like it doesn't come at a rush at you. Like it's not like exciting every day. It's like exciting, and then it's like boredom for like 2 weeks, and then maybe like another exciting experience. So it definitely, I think all these things you're talking about, are things that make medicine worth it. Like we do love it because of these exciting experiences. And then as you become an attending and you're practicing, every year there's different cases you can think about. Like, wow, this past year there was this case that happened. It was pretty ridiculous, or this was pretty exciting. So that newness,
you get better and better every year.
Yeah.
My perspective has changed over the years. And now that I sort of stand here in my 50s, my young 50s, I see many of my friends from college, and who they're getting a point now where they're having major job changes, career changes, job loss, and
you're talking about your colleague?
My friends from college. So we're all the same age, right? Being 52 as a urologist is very different from being 52 as an advertising executive. That doesn't own the account, the ad firm. Very different. Being an account executive for generic corporation X as a 52-year-old is very different from being a 52-year-old spine surgeon. Very different. Being an out of work orthopedic surgeon in between jobs at 52 is very different than being between jobs as a 52-year-old salesman.
Yeah, no, you're right. You're right.
Very different.
100%.
And yeah, the likelihood of you finding work again somewhere in the country or the world, really, as an orthopedist is at 52 is a virtual certainty.
Mm-hmm.
You may have to move, you may have to change states, go to places where maybe you don't want to live, maybe it's too cold, whatever it is. But not only will you find work, you're going to find high-paying work.
Yeah.
And that's not true with virtually any other field. Now, ironically, this pandemic has sort of even that's maybe not true right now, but that will return to a more normal in the next year or so within the medical field. But in general, yeah.
What do you think is, I don't know if you have to run. It's almost 12:30. Do you got to get going, or are you?
Yeah, I gotta leave soon. So, but you go a few more minutes.
What do you think is the worst part of being a doctor right now? What if you ever could go back and let's just say you had the option to, say I don't want to do medicine, choose something else. What factors in medicine would push you in that direction right now?
Well, for me, the hardest part has always been sort of dealing with the stress of adverse events, adverse outcomes on my patients. That's always been very, very tough on me. I've taken it very, very hard.
You're talking about complications with patients, right? So something bad happens with the patient.
Exactly. And that happens to every surgeon. And I think that a lot of surgeons take that very personally, very hard. This notion of the cavalier, not caring surgeon I think that's that's exception. Most surgeons I know really take their complications very, very hard. And that's for me has been one of the hardest and most stressful parts of being a doctor.
Whenever you have a complication, do you feel like quitting?
I'm sorry?
Whenever you have a complication, do you feel like quitting? Do you have you're not going to act on it, but you have this like impulse within you, like, oh, like, why did I pick this? When your patient
absolutely
that happens.
Absolutely. And I feel, when they happen early on, you'd be like, okay, you know what? I'm never going to do that case again. And then it happens on a different case. And you're like, well, I'm never going to do that. And then it happens on another case. And you're like, I'm never going to do that case again. And at some point, you just have to do your cases.
Yeah.
Because
you're gonna eliminate every possible case out there if you go down that list.
And there's literally nothing that you can prescribe an antibiotic and the person has a horrible complication from the antibiotic. And so what, you're not going to prescribe anymore? It's very, very tough mentally. I think that I was doing a YouTube live with Charlie and Baudry about this MSNY peer-to-peer thing. Mm-hmm. And in researching that, I came across a video on a physician who was going to commit suicide. And the instigating factor for him was, from what I gathered, he put an endotracheal tube into the esophagus and the person died. And he took it very, very hard to the point where he actually attempted suicide. But you can argue, obviously that's a horrible outcome, but he didn't go to work that day saying to himself, I'm going to orphan 3 kids.
Yeah.
He was trying to do the best he could. And that was probably many years ago before they had the monitoring and all the things now that make that less likely. But I don't go into a surgery with anything other than the best intentions and the best preparation I could possibly do.
Absolutely.
And even despite that, it doesn't always work out.
No.
Well, that's very tough on doctors.
Yeah. No, I'm 100% with you. 100% with you. I think I've done multiple social media posts on this, and really complications are the hardest part of what we do.
No question.
Try to warn the patient, and you try to warn their family. And, sometimes they're more accepting than others, other times, but yeah, it's the toughest part. And I literally get an impulse sometimes. I'm like, oh, like, why am I doing this?
Right.
And this is why it's very important. We think about our surgical indications, and you really give a good patient consent before. And this is definitely matured for me as I've practiced, is that I spend a lot of time on that consent and sitting there and really detailing out all the complications. And it's not to make them nervous about the surgery or whatever. Obviously, I reassure them that it's a safe surgery, but these are all things that can happen. We're not saying it probably will happen, but when it does happen, it's a very real thing for the patient. That's usually the phrase that I say. Now, with everything you're saying, like experiencing complications, now we can probably go on and on about all the other issues in healthcare today. Consolidation, independent practice, like how you started out for the first 15 years, been tougher and tougher to do now. It's almost like, I hate to call independent practices mom and pop shops, but it's almost a similar phenomenon that's happening, with like the Walmarts of the world and everything like that. There's these big healthcare conglomerates that are coming into the marketplace, and doctors have kind of lost a little bit of their financial independence and their status. And we're kind of like a dying breed, independent practice. I hope we're still around in 15, 20 years. There's no guarantees right now that number is shrinking. And so there's a lot of other factors like insurers, and we can go on and on. But with everything, all this pain that's also going on with medicine, and also, looking at the complications you've had in your career, and you weigh out all the positive things that you've also spelled out for us, would you recommend medicine as a field still? Are you recommending it to your children? And, would you decide to go and do it all over again if you got reversed back in time? This is the hard question. Would you do it? And let's do an honest answer. You can say no and be honest about why. And there's no pressure to say yes here, even though we always do almost, right? Like we almost feel like this pressure, like we didn't regret this decision and we love our patients. But sometimes there is some regret.
Well, it's a very hard question to answer, honestly, because of the social psychological phenomenon called cognitive dissonance, right?
Yeah.
So those of you who took psychology in college, we like the things we do. Otherwise, from a cognitive perspective, why would we be doing them? So you can actually change attitudes by changing behavior, but a separate discussion. So I actually have enjoyed it over the years. Would I talk my kids out of it? Absolutely not. I would not talk my kids out of it. What could you possibly tell your kids to do that will more or less guarantee them for the remainder of their professional lives economic independence from you or employers or anything else, and a skill set that will take them well into their 70s?
Yeah.
None. I can't think of anything. Yeah. And if you think about when did you come out of med school? Well, Dan, what year?
So a while back. I don't really put that out there. Yeah.
Okay.
Yeah.
When did you finish? When did you finish training?
When did I finish training?
Fine.
So over 5 years ago.
Okay.
Yeah.
So well, my point is that coming out of medical school in 2008,
mm-hmm.
your economic prospects were much different than coming out of college with a degree in consumer behavior.
Yeah.
Right.
Yeah. You're right. 100%.
Coming out of medical school in 4 years from now, I suspect your economic outlook will be way different than someone coming out of college. Or if you graduate I'll rephrase. If you're graduating from college this year in 2020, or you're graduating from medical school 2020, medical school, you may have to go into a COVID unit, but you have a 100% employment. Not guaranteed you'd sit. Whereas coming out of college this year, you're done.
Would you? So let's say you're not going to discourage your children. Would you encourage them? Are you going to push them and say, "Hey,
I don't push.
you should really look into, you know"?
I don't push. My kids see.
What about guidance? Like, what kind of career advice are you going to give them?
I don't know how to tell a person to be successful in life. I can tell them what kinds of things to do to be an abject failure in life, like addicted, commit a felony, drive drunk.
Yeah, don't do those. Don't do those.
Get pregnant as a teenager. These are things that if you just avoiding them, you do okay. Any one of those things, you're guaranteeing yourself a lifetime of hardship. But I don't know what to tell someone to do about being successful. That's harder.
Success is in the eye of the beholder too. And
that's a whole other discussion. What defines success? That's very hard discussion.
So you are really not promoting the career of medicine to your children then at this point?
Only in that my kids know that I love it.
Fair enough. And on that note, I think we should probably wrap up this live chat. Thank you so much for your time, Rich. And
thanks for having me.
And I think this is a good conversation. I think that, a lot of the pre-med students who find my channel, I do a lot of Dr. Reacts videos. I watch medical dramas, and they're trying to find inspiration for whether a career in medicine is for them. And I get it. It's a big decision, and it's a lifelong decision. It's a 15-year journey for most people once they make that decision from after high school. It's a significant chunk of your life. And I think that you shed some very important and relevant insights to help people make a very informed decision. So I appreciate your time to do that. And this will live on the channel, and hopefully will impact lots of pre-med students. Okay.
Right. Thanks, Dan. We'll talk later, right? I'm gonna head out.
Thanks, Rich. Okay. Bye-bye.